Communication difficulties are often the biggest challenge faced by stroke survivors. It deeply affects not only their confidence, but also significantly impacts the overall quality of life for both them and their caregivers, making everyday interactions much harder.
Stroke survivors can have different communication disorders depending on which brain area is affected, making rehabilitation complex and needing tailored approaches for each patient.
So, what types of communication disorders can stroke patients suffer from, and how do we handle them effectively? This series is designed to explore that in depth, starting with anomic aphasia, one of the most common language-related conditions that can occur after a stroke. This problem mainly affects stroke survivors, but people with other neurological disorders can face it too. Sometimes it's even quite mild or subtle, making it easy to overlook at first, especially when symptoms don't seem very obvious. Alzheimer's, Parkinson's, and other neurological diseases can lead to various communication challenges. So, what exactly is anomic aphasia? What symptoms does it present? And what difficulties do patients commonly face? More importantly, how can caregivers and loved ones provide meaningful support? In this video, we'll cover all these questions in detail. If you're caring for a stroke survivor or someone with similar conditions, make sure to watch till the end. Let's get started. In simple terms, aphasia means difficulty with communication. There are several types of aphasia, and anomic aphasia is one of them. It primarily involves trouble finding the right words to express thoughts clearly. This can be very frustrating for the person experiencing it, even though they often understand what's being said perfectly well. People with anomic aphasia usually understand speech perfectly and don't struggle with comprehension. Their main issue is picking the right words when they speak. Their overall language skills remain intact, but retrieving the exact word at the right moment can be quite challenging. For instance, they might clearly know what an apple is, but instead of saying the word apple directly, they might describe it as something you eat or a round, red fruit. They often need hints or suggestions to help express their thoughts clearly. These are some of the key signs that indicate someone might be experiencing anomic aphasia, which affects word retrieval rather than understanding or fluency. The main challenge here is really struggling to find the right words to explain things clearly. People often have a tough time retrieving specific nouns or verbs, even though their overall fluency remains fairly intact. So, the way they speak tends to be more descriptive and roundabout instead of straight to the point. They usually understand the question perfectly, but then give an answer that doesn't quite fit or misses exactly what's being asked. For example, if you show them a picture and ask them to describe what's happening in it, they might talk around it using other details instead of naming the object directly. They might struggle to describe things clearly and often end up speaking indirectly, which means using different sentences and gestures just to explain one simple word. This usually happens when someone has had a stroke affecting the brain's left hemisphere, which is crucial for language processing. It can also occur if someone has suffered a traumatic brain injury, has a tumor, or is experiencing a degenerative disease in that area. Even brain surgery that impacts the language centers in the left hemisphere can lead to difficulties like anomia or aphasia. Specifically, the damage tends to be located in the back or posterior part of the left temporal lobe. That region plays a key role in word retrieval and object naming. When this area is affected, people struggle to find the right words and instead describe things indirectly, relying on various gestures and circuitous explanations to communicate their thoughts. When someone has anomia or aphasia, how exactly does a doctor go about diagnosing anomic aphasia in such patients? Diagnosis involves thorough neurological exams, speech and language assessments, and various brain imaging techniques to pinpoint the issue accurately. Treatment methods include comprehensive speech therapy, focused motor rehabilitation, phonological cueing, and assistive strategies designed to improve communication skills effectively. Now let's discuss some practical self-care tips specifically for those living with anomic aphasia to help them cope better in daily life. Use aids like whiteboards, flashcards, and gestures to express yourself clearly. Practice word retrieval exercises regularly, such as sorting foods or objects into categories, to improve language skills and find the right words more easily during conversations. Use items like utensils and furniture, then have the patient look around their space to identify these objects and try to name them. Picture naming tasks are also key exercises that should be done daily.
These work well with the support of a speech therapist. Managing stress and fatigue is just as important because communication issues can be very frustrating and even lead to depression. That's why coping strategies and motivation are essential. Managing stress and anxiety is key throughout this process. Regular breathing exercises, a healthy diet, and meditation can really help. Family and caregivers play a vital role in supporting those with anomic aphasia, as most communication goes through them. Misunderstandings can quickly cause frustration and setbacks. So it's not just the patient who matters. The whole support system must work together to create patience, understanding, and encouragement for better progress. Family involvement is absolutely crucial when caring for someone with anomic aphasia. It's important not only to understand the condition thoroughly, but also to actively learn and apply communication strategies that can assist the affected person. Staying engaged in their rehabilitation process while keeping a positive and social attitude truly makes a big difference. The more interaction they have with family, friends, and even neighbors, the better their communication skills tend to improve. Regular practice using tailored strategies combined with patience and ongoing support creates a nurturing environment that significantly helps with recovery and strengthens communication over time. Facial rehabilitation programs effectively combine both physiotherapy and speech therapy to significantly boost communication skills. These carefully designed exercises not only address speech difficulties but also focus on strengthening facial muscles and enhancing facial expressions, which are vital for improving overall communication. If you or a family member is struggling with anomic aphasia, please don't hesitate to contact us for personalized guidance and support to help you through this journey. With that, I'll wrap up this video. See you in the next one.